talk about the detox and what is happening when your body is going through a detox. Actually, your body is detoxing every day. Okay? How do you do detox? Colon is the first thing. So when you have bowel movement, that's the body is detoxing. Okay? And how many bowel movement you should have a day? 2 to 3 bowel movement. If you don't, you still consider constipated. If you eat 2-3 times a day, you should go 2-3 times a day. You know, if you have kids and baby before, they eat and poop. Okay? Now what happened after they start eating table food, they're eating macaroni and cheese, they're eating french fry, and they don't eat vegetable. What happened to those kids? They start pooping marbles. Okay, you know, it's just the way it is. And the mommy didn't pay attention. They don't drink water. What do they drink? They drink milk. They drink juice. And so what happened? The bowel movement are slowing down, and then they start developing a lot of allergy, infections. Okay, and then what happened? That's the beginning of taking antibiotic after antibiotic after antibiotic. So next thing your body also detoxes through the urine, bladder. Okay, and we need to drink a lot of water to help the body to flush. There's a saying from Dr. Young. That where I learned it from. He said, "Pee your way to health." Okay, and you have to drink a lot of water. And if your urine is still yellow and have odors, you are not drinking enough water. Okay, and when I say water, I didn't mean soda water. I did not mean Gatorade. Okay, I did not mean juice. I mean pure water. You can put lemon, you can put lime, in fresh lemon and lime in your water, but you have to drink water. How much? Half your body weight by the ounce. So if you are 200 pounds, you need to drink 100 ounces of water. If you're 150 pounds, you have to drink 75 ounces of water. Okay? So that's based on, now you drink coffee, you need to drink more because coffee dehydrates you. If you drink soda, it also dehydrates you. So those are the no-nos that we need to know. Then third thing is the body detox through the lymphatic system. We have a lot of lymph node here, in the uterus, ovary, and gentlemen will be in the prostate. Okay, the whole lymphatic system is concentrated in this area. So what happened when you have a sore throat? It is actually detoxing. It's actually detoxing. Okay, but we didn't understand that. So we went and take medicine to suppress it back into the system. So the symptoms go away, but the toxins never go away. And so that's why a lot of kids, they have antibiotic after antibiotic every month because the body said, I want to get rid of this poison, but the medicine push it right back in. Okay, so we need to understand what happened when a sore throat is just the way your body is dumping poison. Now what happened is, how many people having problem in the tonsil, breast, uterus, and prostate? Isn't that where most of the cyst, tumor, fibroid, all that is growing in this area? Why are they growing there? It's because the toxins never had a chance to come out through the colon and the bladder. We're not pooping enough, we're not peeing enough. Okay? And so those toxins stuck in the lymph node, and then if it gets too much, you're developing a term called cyst, tumor, fibroid, or cancers. That's just a collection of toxins that's stuck in those lymph nodes. Now, medicine, we go cut it off, which is okay, but if we don't go back and clean the whole house, it keeps coming back. So we have to learn how to help the body to cleanse the toxins, not just taking medicine or doing surgery. We have to go home and clean house. Then what happened? Skin is another largest elimination organs. Okay? When we sweat, it's the body's detoxing. Now, what happened? We're doing over here. We pluck it up. We pluck up the sweat glands that's supposed to detox for you. Now, we pluck it up with deodorant that have aluminum, these toxins are going to go right back to here. So we did a good job to help our body to develop cancers and other problems. So we have to understand Mother Nature. We have to understand the sweat glands, this area that throw the toxins out is a natural way of doing it. Respiratory, your nose, your lung, is when you have mucus, what does that mean? Mucus is the way to clean out the toxins. So when you have a runny nose, when you have mucus, it's your body is trying to clean up mucus, toxins. Don't suppress it with antihistamine. Don't dry it up. If you keep doing that, you're going to dry up all the layers and layers and layers of toxins. That's why we develop chronic sinus problem. We develop chronic allergy problem, and these people live with an antibiotic all their life. So understand the body will want to detox, but when we have symptoms, we don't go and pluck it up. Okay, I have someone share this. They said, well, blowing the nose is gross. It's gross, they said. I said, so is going to the bathroom. Bowel movement is gross. Okay, so is urination is gross. You want to pluck that up too? No. So we have to understand this 5 areas. From now on, once you know this, next time when you do have a cold or runny nose, you need to understand, okay, my body is trying to dump something out. What have I eaten the day before? What have I been doing to cause this mucus? Now, when I cheat, because I do cheat once in a while, and I eat extra sugar, extra milk product, the next day morning, my nose will be running. And I know my body is trying to clean up the crap I ate before, right? But I didn't go and take an antihistamine to dry it up. I help it to encourage. The next day I drink a lot of water to help it to get rid of it. You see? And now if I don't understand that philosophy, I would take an allergy pill to dry it up. Now what am I doing? I'm starting to help my body to create a chronic sinus problem. So you guys get that idea? Okay. So next, when your body goes through a detox symptoms, you are not allergic to whatever you're doing, okay? Your body is cleansing, and it cleans out in layers. If you take a lot of antibiotic, you have a lot of layers to clean out. You take a lot of antihistamine, you have a lot of layers to clean out. If you're taking a lot of strong medicine, you have a lot of layers to clean out. So when people are starting a health regimen, as simple as just stop eating sugar, your body will go through a cleanse, okay? Or even as simple as stop drinking coffee, you have a 3 days detox headache, correct? Mm-hmm. Okay, so the body needs to go through detox. So even when people take drugs and they go to a drug rehab, what do they experience the next few days? They have snot coming out and they just feel miserable. And what is those rehab will do? Just leave them alone. Let them come out, right? So it's the same thing whether it's legal drug or illegal drug, it's the same thing. The body will want to detox. So when you go through detox, sometimes you will have fever, you have flu-like symptoms, sore throat. It is okay. It is okay. Don't be scared. You just need to up your water, up your antioxidant, up your vitamin C, and sometimes I use the herb Echinacea golden seal to help the body go through the cleanse. Okay, and so what do I use to help my clients to cleanse? Right in the beginning, every one of you heard of we need to eat more fruit and vegetable. Okay, that just been brainwashed in our brain for so long. Now, why are we eating more fruit and vegetable? Because there's component in fruit and vegetables to help your body to cleanse. There's fiber in the fruit and vegetable to help you to cleanse, right? Now, so I don't like juicing because you throw all the fiber away. We need that fiber. That fiber in fruit and vegetable is like your brush for the toilet. You need the fiber to scrub the colon, so save your fiber, okay? So what do? Is I help people to use this one particular product because 1 scoop of this powder is equal almost 5 pounds of fruit and vegetable. So if you look at this food pyramid, which actually look different than the FDA pyramid, is upside down. The grain should be here, and then they don't even have water in the pyramid. So this is the zone pyramid that I have learned from Dr. various years, that this is covering this part. We have to eat more fruit and vegetable. Why? Because there's a lot of nutrition in fruit and vegetable that we need to help to cleanse the body. Another thing is, when you look at perfect food, milk is not a perfect food, okay? If you still believe in it, you've been living in the cave. Okay, so milk is not the perfect food. Don't touch cow's milk anymore. I don't care if it's organic milk. don't touch it because it creates a lot of mucus. The body cannot digest that milk because it has pasteurized and homogenized it. The enzyme supposed to digest that milk is no longer there. That's why people are allergic to milk. Okay, so just don't drink cow's milk. Okay, you can have a little bit for your milk or for your tea or whatever, but don't drink cow's milk. So we need to eat more fruit and vegetable. Another thing is, people worry about calcium. Okay, calcium. Where is the cow eats to get their calcium? They eat grass. Do they take calcium pill? Do they drink milk? No, they don't. They eat grass to get the calcium. And what do they eat to get all that muscle, the protein from? From grass too, right? So you don't have to be a meat eater to get protein. You don't have to, but you should eat a little bit of meat. So I want you to follow this food pyramid. Most of your diet should be here. Now, a lot of you said, I don't have time to shop. I don't have time to cook. I don't have time to do that. And this is a cheap way to do it. Now, what I do is I use this product, fruits and green, a little bit more to do something called green smoothie. Now, I learned this from Dr. Robert Young. He wrote this book called The pH Miracle. He said you have to give your body the greens, okay? The more green, the better. Now, I know you can't chew the greens enough. You can't eat 5 pounds of vegetable a day. It's just impossible. So what are we doing is we're using the blender to doing the chewing for you. The blender is doing the chewing for you, okay? And so I'm gonna let you taste the green smoothie in a minute. I got it in the fridge ready already. And so when I start with my clients, now if the gentleman that I helped lost 100 pounds, he literally did the green smoothie fasting. Okay, now he did not lose 100 pounds overnight, but it takes 1 year to do that. And I put him on a fasting program by just drinking green smoothie and eat nothing. Now that's a little bit harsh. Now if you don't want to fast, it's okay. We can still do the green smoothie with a little bit of food. Okay, but if you do fasting, it can speed up the process. So what is the green smoothie? In there, avocado. Okay, don't be afraid of avocado. Avocado is God's butter. It's God's butter, okay? You can eat all you want, all day long. In there, I have a lime. I peel the skin off. 2 Roman tomato, 1 cucumber. If it is wax in the skin, peel the skin. I have some sweet peppers. If you don't have it, it's okay. It's not a must. And then 2, 3 sticks of celery. Carrot, maybe a small one, not too big, because it's still very sweet. And a handful of parsley, spinach, or kale, or Swiss chard, anything dark green vegetable. Today, the drink you're going to have is parsley and mint. It's very, very nice. And a handful of raw almonds, and 1 to 2 teaspoons of chia seeds. If you can't find it, it's okay too. You don't have to have it, but chia seeds is very, very high in omega-3, just like flax seeds. And then to add 2 scoops of that fruits and green powder because it's a supercharged green food in there. And then 3 cups of pure water, blend it to 2, and then a cup of ice. And if you want to add some protein, go ahead and add some peas protein or hem's protein or whey protein. You know, just you can add that in there if you want. So make that as a green smoothie, and you can. This is your meal substitute. Okay, and that's the beginning. Now, if you said I don't want to fast, it's okay. You don't have to fast, but put that big green smoothie with some eggs in the morning. Have some protein in the morning. And then lunch, a big green smoothie, have your chicken salad. And dinner, a big green smoothie, have whatever meal that you have. Okay? So that's the way to add green smoothie into your program. If you said, I don't have time to do green smoothie, it's okay. Do it at night, put it in the fridge, in the morning, you're ready to have it. Okay? So that's the beginning. Now, if you said, I don't have time to do the smoothie, it's okay. Just do the powder, is still a good start. Next. Okay. Then balance. What do we need to balance? We need to balance that stress. The stress cortisol. Okay. We need to get that cortisol down. You know, right now, there's more people having a thyroid problem. Yeah?
Right.
You guys, a lot of people having a thyroid problem. Do you know there is these 3 glandular, they all work together. These are 3 glands. They are adrenal, thyroid, and the pancreas. They work together. Okay? A lot of people have thyroid problem here, then what you get? You get a thyroid pill, right? But the root problem is not the thyroid. The root cause is the adrenal. And what causes the adrenal to be so stressed?